I think it'll be difficult to stop it without a shutdown, unfortunately. I've often had a theory that if we could literally stop everything for 3 weeks, and I mean virtually everything other than emergency care, we would probably do a significant benefit to the community by getting rid of the virus in that fashion. Now, that's a really difficult thing to do, and I kind of heard some of the comments before. We're not, we don't live in a police state, and it's very difficult to get everybody to cooperate in a circumstance like that. In the interim, the reality of it is that you really want to mitigate and minimize the amount that you're going out and doing things right now. It's in everybody's best interest to do that. And one of the things that I really like to just kind of get the message across is virtually every urgent care and virtually every emergency department in the city now is incredibly busy, but a lot of it has to do with the worried well who want to get tested. Really need to try and reduce that as well, because we're now overwhelming again our reference laboratories, and that's why we're seeing 5 to 8 to sometimes 10 or 12 days turnaround for results. We do not have unlimited supplies for rapid testing. We do have some available, but it is definitely still limited. And it's important that if you're not symptomatic, the best thing you can do is stay home, reduce the amount of interaction that you're doing. There's really not a need to get tested if you're just curious, do I have it or not? You should have good reason and good logic behind why you're going to be tested. I'm beginning to have some symptoms I need to know, or I'm having some trouble breathing, or as previously I heard, you're taking care of a loved one who's immunocompromised and you want to be safe. Those are really valid reasons to get tested. Getting tested just because I'm curious, do I have it or not? And then taking the approach that, well, my test was negative, so I'm good. I can go do whatever I want to do. I'm safe. That is really the wrong message. We got to be very, very careful about that as well.